Stephanie. Thank you. We're so glad you're joining us today. My name is Stephanie Funes, and I serve as the program coordinator for Drug Free America Foundation. I do have a couple of things to mention before we get started. First is a little bit about our free virtual marijuana course, which is about reducing marijuana use during pregnancy and postpartum. As you can see, this course is completely free, and we want to help professionals and our community members navigate this issue. So we're offering this free science-based course that provides the latest research trends and the best practices for supporting women in making informed decisions about marijuana use. We also have our Photo Boys project, which is a current ongoing project. This initiative is designed for mothers and mothers to be in Florida with lived experience of substance use, whether in treatment, in recovery, or personally impacted. We want to encourage them to share their stories, build connections, and inspire meaningful change using photography. And then now let's jump in. The reason why we're here, our webinar. Today, we're gonna get to talk about parents' perspectives on youth cannabis, perspective on youth cannabis use and mental health, impacts, challenges, and recommendations. So I'm gonna go ahead and hand it over to Kathleen Moore now.
Thank you so much, Stephanie. Good morning, everyone. We are so excited to be here this morning to share some of the work that USF has been doing with the Hillsborough County Anti-Drug Alliance. I'm just going to quickly share the reason and rationale for our collaboration. I personally have been working with the Anti-Drug Alliance for 20 years, I would say, a long time. I've been working with Ellen a really long time, and we've had a really long collaboration working with students and mentoring. Some of the work that I do, a lot of the work that I do is community-based research and really trying to bridge that gap between research and practice. And so we're always trying to have students understand the importance of working in community and really sharing that perspective with them. And so we had the opportunity 2 years ago to work. We have a summer research institute, and we have a student that's going to be presenting some of the work today, Zena, who worked with us and was really interested in looking at cannabis use and really getting the perspective of the parents. And so we were able to, with Ellen's help and the Anti-Drug Alliance's willingness, to interview parents that had a child, a boy or girl, have issues with cannabis use. And she's going to share some of the results of that study, along with Ellen, who's going to really kind of give some background. Ellen's been working in this field for a really long time, is just phenomenal in terms of policy, particularly when it comes to marijuana use and alcohol. And so she has some information that she's going to share first, and then we're going to jump right into Zena, and she's going to talk a little bit about the study and some of the findings, and then following it up with somebody, Sky, that's on with some lived experience. So we feel like it's going to be a great hour and very robust, and we're excited to get started. So I'm going to turn the baton over to you, Ellen.
Well, good morning, everyone. Ellen Snelling with the Hillsborough County Anti-Drug Alliance, and I have experience with co-occurring disorders with my daughter. She was diagnosed with cannabis use disorder and bipolar disorder at the age of 16. So I have experience in my own family with marijuana and mental health. Next. I'm just going to give you a little background on how we got to this place. So I think it started with the rising potency of marijuana. In the early 90s, the THC content was only around 3.7%. And then in 2021, according to the DEA, the content went to over 15%. What is marijuana nowadays? It's not like it was back in the 60s or 70s, like a rolled joint. Now it's everything. And I'm going to show you some of the products, but dabs, concentrates, very high potent THC. This is what the DEA has as far as a graphic depiction of how the surge in THC content has gone. So you can see it's just going like straight up. And from 3.9% back in the 90s, all the way over 15. And if anyone goes into a dispensary in Colorado, you can find 30% THC flower and more. What do these products look like? Well, looks like we walked into a candy store. So they're following the tobacco playbook, right? To me, they're marketing to our young people, to our children, with the bright colors, the fruit flavors, everything from soda pops to cereals to snacks and to candy, full of THC. This is the 21st century marijuana. We have edibles. These are really one of our biggest issues when it comes to children, because what child wouldn't want to eat or drink these products with the soda pop, with the crazy cartoon depictions on the front, bright colors, fruit flavors, lollipops. I mean, all kids like lollipops, donuts, and even the medical industry is getting in on this. Of course, they have candy in these edibles, and they have medical cotton candy. Who would have thought? But the problem is THC is added to all these products that look very similar to regular foods. And we also have vapes. We all who have children or grandchildren that are in teenage years, vapes are an issue. Mainly it's the nicotine vapes, but these products are all very highly concentrated in THC. They can be found in recreational states, and they look like nicotine vapes. They also look like flash drives. So I feel like these products really fool a lot of parents and teachers. When a child has one of these products, you wouldn't even know what it is. But in this case, these are loaded with THC in their vapes. 24 states have legalized recreational marijuana. Fortunately, Florida, as you can see in the gray, did not. And we are super excited about that. We defeated Amendment 3. There's still a lot more work to do because they're trying to get back on our ballot for 2026. But almost half the country has legal recreational marijuana, and a lot of the products that I showed you are available, and they get into homes. Maybe an adult gets it, and then a child can get their hands on it. And it's leading to a mental health crisis. So I'm going to talk to you a little bit about how marijuana affects the developing brain. This particular slide is from SAM, Smart Approaches to Marijuana. I highly recommend them. Please go to their website. There's so much great resources there. So we're going to look at marijuana use, especially for a young person. We know the brain is developing to age 25. In men, it's thought to be possibly to age 30. Some of us might think it might be longer than age 30. But anyway, marijuana is very harmful to the developing brain. It's associated with poor mental health outcomes. Heavy, frequent use, especially at a young age, has the greatest risk. The use actually changes the brain, the gray matter in the brain of these young users. Youth who initiate marijuana before the age of 15 are at much greater risk of short and long-term memory problems. Adolescent marijuana use associated with great risk for mental health issues, including depression, suicide, schizophrenia, and psychosis. Chronic use is associated with cognitive impairment and decline, IQ loss, and of course, educational performance and outcome failures. Next, please. Sorry. This is just a graphic, and I want to mention at the bottom of many of these slides, I'll have the reference. You can just click on it, go directly to that reference, and read the whole research study. But this particular one showed how non-users had a normal IQ, and then early and persistent marijuana use starting at a young age, the high THC marijuana over a series of years checked them again in midlife, and they had an average of a 6-point IQ decline. Next, please. Now I'm going to talk to you a little bit about cannabis psychosis. And once I get through with this slide, I'm going to talk to you about what is psychosis. What does it look like? So THC can induce transient psychotic symptoms. And this is fairly common. Some people might enjoy certain types of psychosis, but for the most part, it's very scary. Evidence supports cannabis causing psychosis. And we're talking about not just the temporary psychosis, but chronic psychosis, such as schizophrenia. Studies, especially the last several years, epidemiological evidence showing an association between frequent cannabis use and psychosis outcomes. And if a person develops psychosis and continues using, they're much more likely to have more psychotic outcomes. So, and the risk for conversion to schizophrenia is highest with cannabis use. So we have cocaine, we have meth, other drugs cause psychosis, but the drug that causes the most conversion to schizophrenia is cannabis. So that's how dangerous it is for mental health. What is psychosis? What does it look like? Psychosis is characterized as disruptions to a person's thoughts and perceptions, making it difficult for them to recognize what is real and what is not. One example, hearing voices, auditory hallucinations, strange sensations, unexplainable feelings. For example, some people feel like there are bugs crawling on them, but there aren't. Seeing glimpses of other objects or people that are not really there, talking to a person that's not really there, having strange, persistent thoughts and behaviors, believing external forces are controlling thoughts, feelings, and behaviors. This could be anything from like your cell phone, microwave, laptop, somehow controlling your thoughts, or it can be that these devices are spying on you. Those are some typical types of psychosis. Then a person feeling like they have extra special powers, that they are on a mission, and even that they are God. Or I know of a young man who was using Delta 8, had a crash. The police pulled him over. They called him his name that was on his license plate. He said, "That's not my name. I am the Holy Spirit. You must call me the Holy Spirit." And he doesn't even remember saying this, but he had a psychotic episode caused by Delta 8. But those are some examples. So what does the research say? Cannabis use in adolescents is highly related to psychosis. This is a study out of Canada. We all know that they have completely legalized recreational marijuana across the whole country. Well, they studied Ontario residents between the ages of 12 and 24 using various records. And they found that compared to not using cannabis use was associated within adolescents 11 times greater risk of psychotic disorder at any point during adolescence. 11 times. The study found an age-dependent association between cannabis use and psychotic disorders, consistent with the theory that adolescence is a particularly vulnerable time to use cannabis as the brain is still developing. Again, the resources at the bottom if you want to click on it, and you all can have a copy of the slides. Next, please. Now I'm going to give you a quick lesson on Delta 8 THC. So you saw all the states that have legalized recreational marijuana. So I'm going to show you another map of the ones that have legalized what we call Delta 8 THC and the hemp cannabinoids. And a lot of the states that haven't legalized recreational marijuana, well, they have this stuff. So it's synthesized from CBD or hemp. It's legal because of a loophole in the federal farm bill that was passed in 2018, legalizing hemp. And that bill says that hemp may have 0.3% Delta 9 THC. It doesn't say anything about Delta 8, Delta 6, and all these other isomers. So that's the loophole. It is sold in gas stations, convenience stores, smoke shops, CBD shops, health food stores, and online, producing intoxicating effects very similar to marijuana, Delta 9 THC. The Delta 8, Delta 6, all of those are very similar to marijuana. There's very little oversight. Some states don't even have an age limit. Hemp products sold as Delta 8 are often not pure and may have other compounds such as heavy metals or pesticides. And then, of course, even though I'm talking about Delta 8, which is kind of the most popular, there's Delta 10, Delta 11, and many others. Guess what? They're following the tobacco playbook again. Fruit flavors, bright colors, very attractive to children. Edibles, vape products, flour, oils, capsules, beverages, you name it, it can have these Delta 8 products in it. And yes, like I mentioned before, of one case where Delta 8 was linked to psychosis, I'm going to talk about another, a woman that I met named Jennifer and her 26-year-old son, Nathaniel. They lived in Jacksonville, and Nathaniel lived at home. He had a job that he had for over 8 years, steady job. He did great work, got along with everybody at work, great home life, plenty of friends. Everything was going smoothly until he started having some problems. And really at the time, the family really didn't know what was going on, but he was showing signs of psychosis and paranoia. His boss noticed a huge difference. And one day he actually called the police in to do a welfare check. That's how strange he was acting. And not long after that, Nathaniel ended up quitting his job and he started isolating in his room. He was sending text messages to his parents that didn't make sense. He was very, very paranoid. He thought the world was going to end. China was going to attack. He spent all of his life savings on survival gear, including a tent, backpack, all kinds of gear, Amazon packages coming to the house daily. But before the parents could really understand what was going on, this happened just over a course of weeks. They were going to get a psychiatrist appointment. Unfortunately, he got his hands on a firearm and took his own life right in their home. Next, please. And this is Nathaniel, a very handsome, bright young man, had a bright future in front of him, and his life was taken away because of psychosis caused by Delta-8. This is the product found in the room. So the parents had noticed he started vaping. They thought it was nicotine. They didn't pay any attention to it. It's legal, he's in his 20s. But this is what it was, buds burn, and it's Delta-8, Delta-10, THCO, berry gelato, 1,000 milligrams. That's like 100 joints from back in the 60s. That's how strong these products are. And the psychosis he developed from this product caused him to take his own life. Next, please. And so I think this is my last slide, but I just want to, I really like policy, and we can do so much through education and getting people resources they need, but we also need to look at policy. So we saw the map of recreational marijuana. Now we're looking at the Delta-8 legal status. And you notice, like, so in the red and yellow states, a lot of them are recreational states. So they have banned Delta-8 and those products. Why? Well, I think it's because of the competition, but maybe they care about public health and safety. I don't know. The states that are more in the Southeast, they have these Delta-8 products legal. So it's up, since the federal government is not closing that hemp loophole that I mentioned, it's up to each state to either regulate or ban these products. And right now, we just got through our legislative session, and unfortunately, the bills that would help ban some of these products did not pass this session. So Florida's going to have to work on it again next year, and all we can do is educate. So that's the end of my presentation, and I would like to introduce my friend and colleague, Zena Rottle, and she is a PhD candidate student at USF. We work closely together, and she will take it away with her presentation.
Thank you so much, Ellen, for that introduction and also giving us a great background on Delta-8, Delta-10, and every other marijuana product out there. I also wanted to introduce our qualitative study where we did interviews around the United States with parents who had loved ones, young adults, or adolescents who had experienced adverse mental health effects related to cannabis use. So within these interviews, we wanted to understand how do parents perceive the impact of cannabis use and the co-occurring mental health issues, as well as wanting to know what challenges they face when they are navigating the behavioral healthcare system and wanting to get treatment for their son or their daughter. We were able to recruit participants through community agencies. We had Every Brain Matters, which is founded in Colorado, as well as Success for Kids and Families in Florida, and the Insight program, which is across the southeastern United States. Within these programs, we were able to get a sample of 13 participants with 11 interviews, and majority of them were mothers that were reporting on their son's experience. And the age of initial use for cannabis ranged from 14 to 22 when they first started using. And then when the parents first noticed the development of mental health symptoms, such as psychosis and depression and suicidality, started around 14 to 23. So we were able to have this study approved as exempt from the University of South Florida's Institutional Review Board in order to conduct these interviews with human subjects. We analyzed data and found some transcripts. We developed transcripts and developed some codes, and then we turned them into themes. And we used this with Atlas TI software. And as you can see on the graph to the right, we were able to discuss the different mental health issues associated with cannabis use that were reported by the parents that were experienced by the youth or young adults. So you could see that majority of them experienced psychosis, 73%, and this included delusions or hallucinations, as well as depression following that with 45%. And then we had suicidality, where unfortunately 3 of the young adults had committed suicide. And we had 1 young adult who had suicidal ideation but had not completed suicide. And then we had that following with anxiety, paranoia, and mood swings. Within our findings, we had a lot of reports of substance-induced psychotic disorder, mainly cannabis-induced psychosis. And this includes presenting symptoms of delusions or hallucinations, like Ellen mentioned earlier, of seeing things that aren't there or thinking that you are a higher power. And these symptoms occurred while they were using or after they started using cannabis frequently. Some quotes that we had from parents included a mother from Colorado sharing that her son started to become psychotic and started thinking that the mob was after him. While he was in college, he thought his dorm room was bugged. He thought the FBI was after him and became really delusional from using cannabis wax or dabs, which included 60 to 90% of the potency in THC. We also had another parent from Florida who reported on her son's experience where he thought that he could get through the Wi-Fi and travel with spirits to get to other people's houses and have surveillance on their houses due to the cannabis use. Some of our other findings included some socioeconomic impacts as well as just structural barriers that you have in the healthcare system. So, for example, one of the parents stated that they were trying to get treatment for their son, and unfortunately they weren't able to because there wasn't a psychiatrist on duty at the ER that they were in locally. And this is really important because we need professionals who are understanding of the link between cannabis use and mental health challenges and wanting to have a professional who's adequately adept to treat this in the moment. We also had another participant who shared about housing instability and having to pay a lot for the treatment, which led them to debt, and noticing that they they think that if they had a higher income or had better means that they could survive this issue, but because they were from a lower income standpoint, they lost everything. They lost their house, they lost the family dynamics that they had before, and it really brings a tear into the family and can where the parent a lot of times were reporting that they weren't able to see their child the same as before. So, including policy, we had 69% of participants who shared that they were against statewide cannabis legalization in their state, with 30% who were neutral about it. And some of the main concerns from all of the participants included that they wanted to limit access or sales to young people, especially during the teenage years and young adulthood, as well as wanting to understand that there are poorly regulated cannabis products, as Ellen showed us before, the flavored products, the food-induced products with THC that have high potencies that we don't realize until after we notice them. And then there's also the social view that cannabis is a harmless substance and isn't addictive, when there have been studies that this isn't true. So some of the implications for practice and policy include expanding medical training to address provider bias when it comes to cannabis use and seeing it in a socially acceptable light when there have been instances of THC use and frequent THC use related to these adverse mental health effects and wanting to address the problem in the moment before it gets worse. Also wanting to limit access to cannabis among young youth and young adults, especially within some of the marketing tactics that we see today. Within research and future directions, we want to understand how we can develop and implement public health campaigns, as well as do some more research with young adults themselves to get their perspectives on when they first start using, when they have the experiences of onset of mental health symptoms. Because in this study, we were able to understand how their parents perceived it and from an outsider's point of view, but we wanted to understand how they themselves experience it. So another thing with that is to gain insight from youth and young adults who have lived experience with cannabis-induced psychosis or other adverse mental health effects related to frequent cannabis use. So with that, we're going to turn to a community member with lived experience. This is a young adult. His name is Sky, and he has lived experience with cannabis-induced psychosis and other adverse mental health effects from cannabis use. So feel free to tell us your story whenever you're ready, Sky.
Hey, how's it going? I'm a mentor with Florida Recovery Schools in Tampa Bay with lived experience through THC, all of these products and stuff like that. I want to start off by saying, Ellen and Zena, thank you so much for having me on here, as well as all the other board members. I think it's really awesome. I really do appreciate the description of psychosis that you guys gave was the best that I've ever heard. It was very, very accurate. It's exactly how it feels. You know, you feel that people are after you and that they're coming to get you, and you can do all of these telekinesis through the Wi-Fi. Me personally, I had experiences where I was listening to music and I thought the music was telling me to do things, such as like they're going to make me rich and famous or whatever like that. Very strong, and it's a very huge issue. Another large issue about it is a lot of the misinformation regarding THC use. For example, I never really, um, you know, I never did any of the harder drugs. I always wanted to do something, that wasn't going to mess me up. And, you do all this research, or I did in my case, and, you find that, you can't really find any adverse health effects. You don't see anything. Everyone says, oh, it's better than smoking cigarettes and stuff. And that may be true health wise, but get they don't get to the aspect of it to where it actually can cause, schizophrenia if you have, if you have a history of schizophrenia in your past, or even if you don't have, I don't have any history of schizophrenia or delusions, psychotic delusions like that in my past, or in my family history. But yeah, like I said, it really, like, it comes out of nowhere. And the scariest part is you really don't even realize that the thoughts you're having are, what's it called? You don't realize that the thoughts you're having are, not real. Like you're convinced it's all real, and you don't really believe, like, you don't believe anything else because, but yeah, I think you guys really do have the right idea of kind of what's going on. It's a very, very widespread issue. Especially with the Delta 8 stuff. There's not enough studies about it. There's not enough, there's too much misinformation about it. And I personally know about 5 people who were using Delta 8 products. And I was lucky enough to recover from my psychosis, but the other 5 people that I know weren't so lucky, and they're currently spiraling. So it really sucks to see, you know. But yeah, I think I'm gonna go ahead and open up with some questions.
Yes. Does anyone have a question? I have one for Ellen already on the chat, on the Q&A. Sky on the chat, they're saying thank you for your bravery and courage. We appreciate you. So
Thank you
you
so
much
much.
for sharing.
I appreciate it.
Are you going to read me the question, Stephanie?
Yes,
Okay.
it says, Ellen, does that mean that SB 438 and HB 1597 failed? What's next?
Well, okay, now you're going to get me depressed.
Oh
Yes,
my.
they failed. And it was very unfortunate because there was 2 bills out there. They both were good, but they didn't match. So the session ended and they couldn't come to an agreement. And so here we are. So everything's the same status quo. So we have age 21 in Florida. We have some regulations that you're not supposed to market to children, but I'm still seeing just outrageous products out there, 10,000 milligrams of THC in one package of edibles. I mean, so that was the biggest thing that was going to happen with these bills, is to put a limit on the serving size and the amount that could be allowed in a package. And there was so much more to the bills. But like, for example, the Senate bill, SB 438, was 13 pages long, and that was Senator Burton, who's been working on this for 3 years. So I thought it was nice and concise, and it covered a lot. It made all the Delta 8, Delta 10 products illegal, what they call synthetics. They're synthetic because they're not found naturally in the hemp plant, or if they are, like Delta 8 is in a tiny minuscule amount, but it's not, the amount that they have is all synthesized from CBD and a bunch of chemicals. So that was illegal in the House bill. The Senate bill did not make that illegal, but they limited it. They severely limited it. But that's one example of where there was no agreement. So got to start over again next year as far as the policy goes. But what we can all do locally is, I've heard that alcoholic beverage and tobacco, they are now doing compliance checks for hemp. So I just wanted to make sure everybody's aware of that in Florida. So if you do have maybe a place that you know might be selling to underage, please let ABT know. You also can let the Division of Agriculture, I'm sorry, Department of Agriculture, they are over hemp completely. So other complaints that you may see that you're concerned about, you can go to the Department of Agriculture website and report, or there's like an 800 number you can call. So that's what we can do for now. Other than that, we have got to get out there and educate parents, teachers, community members about these products, because sometimes the young people and, the young adults, they know about it, but us older people and, parents, teachers, grandparents, we don't know about it. So we've got to spread the word. Every time I do a presentation, people seem to be shocked knowing these products are out there. So yes, the bill's failed. Thanks for reminding me.
Well, thank you, Ellen. I have a couple of questions. I don't know anyone in the panel that may have an answer. The first is, so what is the drug of choice for cannabis overdose management? I'm wondering if maybe they mean like a medication to help with withdrawal. That was actually the following one as well. Like, what do they do for withdrawal symptoms for cannabis?
Well, I'll take a stab at that. They don't have medicated assistant treatment like for, say, opioids. Marinol is a prescription of THC that you can get from a doctor's office, or a doctor can prescribe it. So it's possible that something like that could help. I'm not even sure if it's used, but it could help to taper off. But in general, there's different therapies like cognitive behavioral therapy, talk therapy, that type of thing to help people stop. There's not a lot of medication. I know with cannabinoid hyperemesis syndrome, CHS, where there's a chronic vomiting, they call it scromining from using marijuana. Some people get that. Sometimes they have to stop cold turkey. So there's no choice. So because if they continue, that's vomiting continues to the point they could tear their esophagus or something. So, but there are maybe some medications to help make the symptoms less. But in general, like I said, there's not really a medicated assisted treatment for it, but there's definitely lots of therapies. And I also have to say Marijuana Anonymous is great. A lot of it is online. And I've heard that that's extremely helpful for people to have a support group to stop using.
Thank you. The next question, it says, what a great presentation. Thank you, Sky. What words would you use to young individuals to take this seriously?
I would say, realize that what you're doing could have real repercussions. I know it may not feel like that. You read all the research and stuff, and it says it's fine, but it's really it can really mess you up, and it really you read some of the news or whatever, and you don't think that stuff actually happens, but I've been out in the community, and most people that I've known that have smoked Delta 8 were in a state of psychosis, and most of them, everyone that I've known has been stuck like that, and they're currently like that. So realize that they're actually this stuff isn't regulated; it's extracted with chemicals, and it's really, really bad.
Thank you. The following question is also for you. It says, how long were you in psychosis after you stopped THC use?
I was in psychosis for quite a while. Most of it was under Delta 8 and THCO. And I was in psychosis for about 3 months, which is actually a really long time to be in psychosis. So once I stopped, I would say, it kind of dwindled down because the day I stopped, I got transferred to a psych unit and I was there for 2 weeks. And, it started slowly and slowly ramping down. And then after those 2 weeks, I would say another week after that, I had slight residual, slightly residual psychosis, but not as bad. So it slowly got better and better as I got uh, clean.
Oh, so glad to hear. The following one does say only answer if you feel comfortable sharing, but what helped you through your psychosis, and how did your experience shape your relationship with your friends and family?
Right. Yeah. I think that's a big problem is it's mainly the relationships that it affects because when I'm in psychosis, I don't really know that I'm in psychosis. Right. So there's not much that I guess can help you get through. I guess love and support from family and understanding, that, you're like that, I guess helps a lot. But, when you're in psychosis, you don't really know it. So, coming out of it, love and support from family is the main thing that helped me.
Um, the next one is not a question, but a note for Ellen. It says hemp-derived THC needs Fed regulation, and that thank you for everything you do. And then lastly, before I move on to the chat, because I've seen a few comments on the chat as well, but I wanted to finish the Q&A first. Someone asking about a plant-based external analgesic for joint pain and swelling. Is that recommended for use? I don't know if anybody feels comfortable answering that. It says, can I use it as a rubra, patient, or pain liniment?
Okay, I think I'll take that. I
Yeah.
believe they're talking like an ointment or a lotion,
Exactly.
topical
Yeah.
use. If it's CBD and no THC in it, I would say fine. If it has THC, you just don't know how much going to be absorbed. So if it's a very high THC cream or ointment, it could be absorbed into the skin. So I would be cautious. And like I said, I think, CBD doesn't cause psychosis or a lot of these other effects. It's the THC that's added to it that really is the issue. So I think a CBD lotion or ointment might help, with pain. It's probably worth trying, but anything with THC in it, I would be super careful because it can be absorbed through the skin. And I wanted to say with Sky's experience with the psychosis lasting for at least 3 weeks after he quit, just think about the fact that marijuana is not like alcohol, right? And I mean, sometimes that's brought out like, oh yeah, it's not alcohol, try this. Well, it has actually worse things that it can do to you. And one of them is it stays in your body. It stays in your fat tissue. So it can take, I've heard of some people taking 3 months to get it completely out where they can pass a drug test after using for many years. But it isn't surprising that the psychosis could last for several weeks because that THC is still in your system and it probably took at least that long to start getting it out. So to me, it's a really scary drug for a lot of different reasons, but I just think the fact that it stays in your body so long and can have residual effects like that is another scary thing about it.
I'd like to answer the ointment thing real quick, or just have I have a little bit of insight on it. Look for labels that say non-psychoactive. That's what you want to look for. If it says it's psychoactive, you kind of want to stay away from it. That means it has THC in it, and it alters your state of consciousness.
Thank you. Now with some questions on the chat. One for Sky is that they wanted to know if you were vaping the products.
Yes, I was. I was mainly vaping the smoke shop products, the Delta 8 products, the vapes, and then the THCO vapes. That's what I was doing. So, yes.
They want to know also, when did you realize that you needed help?
The first time I realized I needed help was probably in the psych ward once I got transferred to Texas, there was a rehab recovery program that told me that I was in psychosis and they couldn't help me. So they sent me to the psych ward, which I was there for 2 weeks. And towards the end, I kind of realized, like, okay, there might be something wrong here. I don't think I can smoke weed anymore.
Wow. And then, well, they actually wanted to also to know if you talk at other events or meetings. I guess they want to hear more about your story.
Yes. So I'm able to whenever, what's it called? Whenever I'm available, usually later in the day, because I work from 9 to 3 Monday through Friday. But anywhere near the Tampa Bay area, I'm pretty much available. Like I said, but yeah, I like doing speaks and stuff, meeting people, stuff like that. I'm definitely able to.
And definitely much appreciated. I feel like it's always nice to hear from someone who's has lived experience. Um, and actually, the next question is, are the young people you know starting to realize how dangerous THC can be?
I'm not too sure. I think it's maybe gotten a little bit better. I hang around mainly recovery communities, but sometimes I get around into other communities like the skateboarding community, and it seems to still be prevalent. I don't know if it's Delta 8 or street carts or medical, but it's still definitely prevalent. Like I said, there's definitely still people using for sure.
So Denise asked if you mainly vaped these products. I know you already said that you did vape these products. Were this, I'm guessing they want to know if you used in any other forms.
Yeah, no, just the vaping. Just the vaping, and then I hung out with a lot of friends that had medical marijuana cards, and I would smoke. Like occasionally, I would smoke a blunt or flower, but that wasn't really. I was, that's not. I don't correlate that to the psychosis as much, but not saying it can't happen, but I was doing that for a while, and I didn't have psychosis. But once I started the carts, it was pretty almost instant.
I just want to jump in there.
Mhm.
And I think the fact that the carts, like you mentioned, and vaping, it's the concentrates. So even if it's medical marijuana, I've seen some of the
It's
medical
yeah.
marijuana is like 86% THC in a vape. So this flower is more like for medical is like 25% or something like that. So it's much stronger. And I think that's one reason
Right.
we see more psychosis with the concentrates.
Right. Yeah, I've seen concentrates up to 99%.
Wow. Someone asked if you had ever received any drug prevention education in school, Sky.
Yeah, but a lot of it was just fear mongering. Like, they told us like, I do whatever, I pledge to stay away from drugs and alcohol. But they don't give you actual information and studies and cases. Like that's how it was for me. I was just told to stay away from it. I wasn't given any reason why. And of course, if you have a stick and there's a bear, you're gonna poke the bear if you don't know what a bear is. So yeah, I think a big thing with me is education. Like I wasn't educated about this stuff. That's why I did it. If I would have known a lot more about it, and like if I would have saw the studies that come out today about THC and psychosis, I would have stayed away from it.
Okay, that is good to know moving forward how to share information for sure. Um, I think I covered all the questions, even in the ones included in the chat. I forgot to mention at the beginning that we will share the recording and the presentation plus the paper, so you will receive an email with that, all of that information. So even if you arrived a little late, you won't miss out on this great presentation. Unless anyone else have any other questions or anything else to add, I'm keeping my eye on the chat in the Q&A
Stephanie,
box.
I forgot to mention this to you all earlier, but you all have a really good sheet. I have it right here, but the rising risks of high potency marijuana impacts on mental health. So if there's some way to put that in the chat or to make that available to everybody, because it's really got great information on a lot of the topics we talked about, and then it has references at the end. So I think that would be good to share.
I'll write that down to include in the email. And then Sky, if you feel comfortable sharing your email, somebody asked for it in the group chat. Oh, there we go. Okay.
Yeah, I just
Well,
posted it. So that's my main method
yeah.
of being contacted.
Perfect. Thank you very much. Well, I want to thank everyone for joining us today. We appreciate your time. Thank you to our panelists. Thank you for your time. We appreciate you and everything you do. Thank you for educating and for sharing your stories. I hope everyone has a very good day, and thank you so much for joining us.
Thank you so much.
Thank
Have a good
you.
afternoon. Bye.